Danish drug maker Novo Nordisk's profits are on the up as its customers are seeing their weight stay down.
It reported first quarter profits of $3.65 billion, better than expected. Constraints on supply of its Wegovy and Ozempic weight loss drugs and competition in the market forced the company to cut prices, but it's now boosting shipments to meet demand. The company is so successful that it is currently Europe's most valuable, worth about $570 billion. That is bigger than Denmark's entire economy.
Well, such is the demand for those Novo Nordisk drugs that stocks for those people who need it are running low and they're being forced to use cheaper alternatives. Denmark has said it will start patients with type 2 diabetes on different drugs, while doctors were ordered to stop prescribing Ozempic to those without the condition almost a year ago.
We're joined now by Victoria Knight, health reporter for US news site Axios. Victoria, thanks for joining us. Novo Nordisk says in the USA alone, 25,000 new patients a week are getting these semaglutide drugs, which basically drastically cut the appetite. Do you think these drugs are ushering in a new era where we're going to turn the tide on global obesity?
Thanks so much for having me. And it's a great question. I think we still have a lot that's unknown. But as you said, huge numbers of people in the U.S. are starting this drug every week, as Novo Nordisk said this morning. I think obviously this drug is effective. It's shown, studies show that it helps people lose 15 to 20% of their weight. But the thing is, one of the kind of unknown questions is, do you need to take this drug all your life for that weight to remain off of you? And I think there's just not enough research yet to know if that's true. And then another huge barrier for these is the cost of these drugs. In the U.S., these drugs can cost over $1,000 for a month's supply. So that can really be a lot for someone, and insurance doesn't always cover them. So
yeah.
These are two of the big questions.
The cost of the drugs extraordinarily high in many countries across the world. But of course, the question then is, we have to compare it to the cost of obesity. We know that it brings with it myriad health risks. How much is obesity costing health systems?
Yeah, that's a great question. In the U.S., according to the Centers for Disease Control and Prevention, it costs the U.S. $173 billion per year. And in the U.S., over 40% of people qualify as obese. So it's really a huge percent of the population that could potentially benefit from this drug. But again, the cost of the drugs themselves are expensive. But on the other hand, the obesity costs the U.S. healthcare system a lot as well.
Is there a case to be made for these drugs to actually be paid for by medical aid insurance schemes or by government health?
Yeah, there is the question of whether, if you're paying a lot of money up front for these drugs, but in the long term, potentially you're kind of reducing the cost of obesity in the long term. There's also evidence that these drugs help reduce the risk of heart disease and stroke. So those are health events that can cost the health system a lot as well. So it's kind of like, do you want to pay up front for these drugs that will help perhaps prevent more costly health outcomes later down the line? Or do you want to pay for them later down the line? So that is something that's really playing out in the U.S. right now. There's a question of whether the federal government wants to pay for these drugs. They're paying for them for people who have heart disease, but they do not allow the federal government to pay for these drugs just for people who want to take them for weight loss. So it's kind of something that's up in the air right now, but it's a big question.
Yeah, and one that will continue to be debated. Thank you very much, Victoria Knight, health reporter for US news site Axios.
Thank you.